Good afternoon. My name is Michelle Mitchell, and I am pleased to be presenting this poster on behalf of the evaluation team at Partnerships for Health and Ermione PA, the Tobacco Prevention and Control Program Manager at Maine CDC. Maine CDC provides leadership, expertise, information, and tools to create an environment in which all Maine people can be happy, healthy, and ultimately reduce disability, disease, and death. Strategies include supporting behavioral and environmental changes to promote healthy living, strengthen the integration of prevention services into health systems, and promote prevention education, communication, and outreach. Much has been accomplished in Maine's public health work in the last 25 years. However, state and local success must not only be maintained but expanded and further refined to address emerging issues and a constantly shifting landscape. In 2016, Maine DHHS organized tobacco, obesity, youth engagement and empowerment, and substance use prevention efforts collectively under the rubric called Maine Prevention Services. Maine CDC contracts with 5 statewide vendors to implement these prevention services. Each vendor, with the exception of Rink Advertising, subcontracts with community organizations to implement these strategies in each public health district. Each vendor reports annually to Partnerships for Health on key indicators. These indicators, as you will see in the poster, capture both activities and outcomes. Certified substance use prevention specialists work closely with other community stakeholders such as law enforcement, schools, higher education institutions, work sites, healthcare providers, and local governments to implement primary prevention activities. These activities are based on the Center for Substance Use Prevention strategies. District tobacco prevention partners work within their regions to implement tobacco use and exposure prevention strategies. One of the main strategies is working with school districts, youth-serving entities, municipalities, lodgings, clinical sites, multi-unit housing, and higher education institutions to promote the development, revision, and implementation of tobacco-free and smoke-free policies. CTI and the district partners also provide training and technical assistance to youth groups and non-clinical providers on how to manage and engage in respectful conversations with their peers and clients about tobacco use and promoting the Maine Quit link as the tobacco treatment resource. Youth empowerment and engagement work is grounded in positive youth resilience and social emotional learning principles. District youth coordinators work in their regions to implement 3 core strategies. Firstly, to build capacity of adult advisors to sustain strength-based, trauma-informed partnerships with young people. Secondly, to create youth policy boards that focus on substance use prevention, youth mental health, and bullying prevention through participatory action research. And thirdly, to convene youth engagement groups that develop youth leadership and encourage youth-led actions on issues relevant in their communities. The Strategic Prevention Framework for Prescription Drugs campaign aimed to generate awareness around prescription medication misuse and drive those affected to the campaign website and to 211 Maine to link to substance use treatment services and resources. The Substance Exposed Infant campaign targeted reproductive age women and at-risk expectant mothers. It aimed to increase awareness of substance use on infants and drive people to the Prevention for Me website for resources. And finally, the Positive Influence campaign challenged youth to engage in critical thinking skills, identify positive influences, and stand up to negative pressures around substance use. It encouraged them to visit the campaign website. Finally, obesity prevention, which was undertaken by Main House Let's Go. The Let's Go coordinators work throughout the state to implement obesity prevention strategies in their local communities. The main strategies include working with school districts and early care and education sites to create healthy environments for youth by strengthening wellness policies. The coordinators also support school cafeterias in assessing their healthy food environments. Let's Go continues to strengthen collaboration with healthcare practices and provides technical assistance and training to registered healthcare providers. In conclusion, by increasing accesses to services and making the healthy choice the easy choice, these efforts and strategies improve the environment where Maine residents live, learn, work, and play. Together with individual behavior changes, these system and environmental changes help improve health across individuals' lifespan. Please join us at the Q&A on October the 7th and keep an eye out for the Maine Prevention Services 2016 to 2019 report. Thank you.